Hi everyone, I'm Dr. Sanda. Welcome to my channel. One of you asked me about effective bone restoration procedures, especially around diseased teeth. The most effective bone regeneration procedure that we have is actually using bone grafting around teeth that have lost bone. However, in the recent years, we're also having a laser treatment that is successful and is less invasive. So I would definitely recommend to try that first before going into bone grafting procedures. And of course, it also depends how much bone you've lost around your teeth. If the teeth are already mobile, there's really nothing we could do to really tighten them unless we splint them and try to do some lasering. But if your teeth are really loose and they shifted positions and they're hanging down, then I think your only option at this point would be dental implants, because that'll last you a lot longer and it's a much more predictable treatment than trying to hang on to teeth that are loose and infected. Otherwise, if your teeth are not loose, you can definitely try a couple of the other regenerative procedures that we have, either laser or bone grafting. And of course, bone grafting can come from different donors. It can come from you, it can come from a cadaver or from a tissue bank, or it can come from an animal. But I always love to mix these bone particulate with platelet-rich fibrin. And PRF is really using your own growth factors and mixing them with calcium hydroxyapatite to put them back in areas where bone is missing. So it can help regenerate the site and also help with the healing of the gum tissue. If you have any other questions, you can also watch my video that I did on the doctors treating periodontal disease, where we actually used laser to treat advanced bone loss around teeth. See you next time. And if you have any other questions in the meantime, you know where to find me. Tweet me at DRSANDA or send me a message right here.